Dental implants are a simulated tooth root, and it's virtually a very similar size, very similar shape to the tooth that was in the position before. So they're usually made of titanium, and they're placed into the same position where the tooth used to be. They are considered the standard of care for certain conditions, one of those being if a person has to lose all their teeth, for example, and needs to have a lower denture made. Today, a lower denture plus 2 implants is considered the standard of care. So it stabilizes things, it doesn't allow the denture to slide around, it minimizes the need for adhesives. Patients just do much better with those. The pain points or the difficulties that people have are twofold. One is the people that have most of their teeth still, and maybe they have to lose a tooth. Well, we go, and our options used to be putting a bridge in there, which is still a fine option if that's the only choice. But those are much more difficult to clean and keep clean, and we see maintenance issues with them, where a single implant, which is a single root simulation and a crown on the top, just replaces what's missing. Much easier to keep clean, much stronger, even stronger than a natural tooth. The second being where there is a lower denture is notorious for sliding around, and putting 2 implants in there can make a huge quality of life difference for these people going forward. We do single implants. That's probably 90% of what we do. The single tooth, we do full arch, where there needs to be multiple implants placed to replace an entire arch, and that can be something that's actually snapped in, or it can be something that's screwed in and the patient can't take it out. Cosmetic is an area that's coming into its own. That's an area where the envelope is being pushed and changed a little bit through research, and something as simple as a front tooth that gets knocked out and needs to be gone can oftentimes be replaced with an implant the same day if there's no infection there to start with. So that, from a cosmetic standpoint, is extremely favorable to the patient. They want to get something back in there as soon as possible. And it's not always able to be done. I would say the majority of the time, though, there is infection, and so there has to be a delayed time before the implant can be restored or even placed. The healing has to occur first.